Hi, my name is John LeBlanc, and this is my current topic presentation. In this presentation, I'll be discussing the effects that robots have in lonely older adults. This newsletter article, titled, "Will CareBots Cure the Loneliness of Nursing Homes?" summarizes the staffing shortages in nursing homes, which correlates to the elderly people becoming lonely. The elderly population across the world is skyrocketing, while the caregivers are gradually diminishing. This is how the invention of CareBots was created, in order to help mitigate staffing shortages in countries such as Japan, which has the highest proportion of elderly people of any country. Currently, nursing homes and assisted living facilities everywhere are beginning to recognize the benefits of robotic caretakers. This is a picture of a service robot called Sayabot. This robot is being currently used in banks and restaurants. Excuse me if I butcher this name, but according to Jaya Krishnan, who is the CEO of Asimov Robotics, stated that the robots have assisted patients who are between the ages of 60 and 85 years old in clinical trials during the year of 2018. The task that they performed was helping patients use the restroom, providing mental stimulation through conversation and games, 24/7 monitoring, and dispensing food, drinks, and medicine. These CareBots also have the capability of calling for human assistance in the case of an emergency. Creating this robot is the most challenging part, rather than designing it. On the other hand, the details of this CareBot matters. There has to be some humanization features to it in order for someone to happily enjoy it. If a robot had a scary voice, you would be afraid of it and not be intrigued to interact with it. Some might argue about how the robot can judge a patient's emotions, but the robot monitors the facial gestures of the patient to judge what is the best care for them. What the best care for them will be. The best example of this is even if the robot has to nag a patient by repeatedly reminding them to take their medicine, it will be thoughtfully done at the best suitable time. When patients were interacting with the robots, they first had anxiety and doubted the use of the robot caring for them. Eventually, after 2 days, the patients became more comfortable with the CareBot. There are also 2 other robots who do not fulfill the caregiver's job, but instead help mitigate the loneliness that causes suffering to residents of assisted living and nursing homes. These 2 robots' names are Zora and Paru, who stand under 2 feet tall and can talk to the patients while eliciting emotions which boost interactivity between everyone. Additionally, these 2 research articles listed here go into more detail about the effectiveness of these CareBots in nursing homes. The first article, "The Psychosocial Effects of a Companion Robot, Randomized Control Trial" by Robinson et al., aimed to investigate the psychosocial effects of the companion robot, Paru, in a rest home hospital setting in comparison to a control group. On the other hand, the second article is titled "Providing Aging Adults Social Robots Companionship in Home-Based Elder Care" by Chen et al. This study aimed to investigate aging adults' demands for social robots companionship and explored in what life situations it was appropriate to accompany aging adults by social robots. The demographics between the 2 articles differed, by the first article having 40 residents in a hospital and rest home care, whereas the second article recruited aging adults as interviewees from an elderly university in Beijing. Their average age was 66.8 years of age, ranging from 60 to 72 years old. 4 of them were female and the others were male. The experimental design for the first article was a randomized controlled trial. Residents were randomized to the robot intervention group or control group that attended normal activities instead of Paru sessions. Sessions took place twice a week for an hour over 12 weeks. Over this trial period, observations were conducted of residents' social behavior when interacting as a group with the robot. As a comparison, observations were also conducted of all the residents during general activities when the resident dog was or was not present. The second article involved 3 phases. Phase 1 collected the life situations in which aging adults lived alone at home. Based on the results of Phase 1, Phase 2 investigated aging adults' demands for companionship, whereas Phase 3 investigated the feasibility of the robot's companionship for aging adults. After the 3 phases, this study compared aging adults' demands for companionship with the feasibility of social robots' companionship in each life situation. In comparison with the control group, residents who interacted with the robot had significant decreases in loneliness over the period of the trial. Both the resident dog and the CO robot made an impact on the social environment in comparison to when neither was present. Residents talked to and test the robot significantly, more than the resident dog. A greater number of residents were involved in discussion about the robot, comparison with the resident dog, and conversation about the robot occurred more. In the second article, based on the results of the questionnaire survey, aging adults had a high level of demands for companionship in the daily occupations of dining, doing housework, exercising, and doing healthcare. Based on the results of the expert evaluation, the companionship of social robots had a high level of feasibility for aging adults in the life situations of dining, short breaking, sleeping, and doing housework. Based on the comparison between the results of the questionnaire survey and the expert evaluation, the demands of aging adults for companionship and the feasibility of social robots' companionship varied a lot. Social robots were suitable to provide companionship instead of human beings in the life situations of dining, watching TV, and relatively applicable to provide companionship in the life activities of doing housework, entertaining, healthcare, reading, and religious practices. In other life situations, social robots' companionship showed irrelevance. This study provided design recommendations for the companion service of social robots and hoped to establish a well-developed human-robot interaction system and to provide better home-based elder care services for aging adults. So, in conclusion, the use of robots in nursing homes was beneficial in helping patients who were lonely. These patients enjoyed interacting with the robots, which increased their social life. By not having a caregiver due to the surge of the older adult population, these robots should be more widely used in nursing homes who cannot take care of all of their patients. This connects with the material that we have covered in class by the effects of loneliness causing poor social relationships, which then leads to an increased risk of physical and mental conditions. These conditions consist of heart disease, anxiety, depression, Alzheimer's disease, and possibly death. With the help of these robots, it will benefit the social life of older adults in nursing homes and across the world once it becomes more accessible in the future. Thank you for watching my current topic presentation, and the next slide you will see are the sources that I used for this presentation. Thank you.